if we move on then from the main agenda, what we're going to talk about this evening, I'd like to introduce Claire Kennedy, who is works with Gloucestershire CCG and has been developing support and understanding about long COVID. So if Ray, if we can hand over to Claire, please.
Hi everybody, thanks for the introduction and thanks for the welcome. It's I'm very excited to be talking to you all, and I'm hoping that what I share with you can help with your own understanding and helping the community to understand what long COVID is and what we can all be doing to help people that might be suffering. I also have invited a person who's been living with long COVID, so Jules is here, and he'll just kind of give us a 5-minute kind of summary of the last 9 months or so of his life. At the end, so we could, but yeah, we feel free at the end of it to ask questions as we go, or at the end is probably easiest. So, oh, sorry. I just tested this and I'm still learning.
Sorry, 1 second.
Can you see a screen that says long COVID on it? Nope.
Alas, no.
No, not at the moment. It's an empty slide. We've got a backup if it doesn't work, haven't we? Because
yes. Now can you see it?
Yes.
No.
Yes. Good. You're going to put it into slide view?
Yes.
Yeah.
So now it should be big. And I'm just going to get rid of everybody so we don't see everybody's faces. All right. So yeah, so long COVID. So this is a very short kind of presentation and it's a really brief overview. At the end, I've put a couple of resources and the slides will all be shared. So feel free to go and have a look. The Your COVID Recovery website has a big overview in a bit more detail if you're looking at going into detail with someone you might know who might be struggling with long COVID. So we're just going to go through what it is, what the symptoms are, how you help someone, and what if they're not getting better. So long COVID has helpfully now known as something called post-COVID syndrome. So if someone is going to talk to their GP about it, there is something called a post-COVID syndrome clinic that they can then be referred to. So if you're talking to a medical professional, it's helpful to use the word post-COVID syndrome because that's what they might be looking for. And they're continuing, so because it's pretty new, because COVID's pretty new and we're starting to see these people still continuing to suffer with symptoms, it's still developing a defined definition. But so far what we understand is it's a collection of symptoms, so it's not just one single thing, it's a whole bunch of stuff that people might be experiencing, and it's developed during or following a confirmed or suspected case. So it's important that there's lots of people out there who never got a test, or when they did get a test, the test came back negative, but they've clearly suffered something that's not a normal flu or normal cold. It's a bit more severe and it might have multiple different types of signs and symptoms. It could be COVID even if they never got a positive test. And it's important that it's confirmed as long COVID when it continues for more than 28 days. They can be fluctuating and unpredictable symptoms. So people with long COVID describe it as a constant cycle of disappointment. So you get better and then you get worse again and your symptoms come back, and you get better again and then you get worse again and your symptoms come back. So it's this changing picture all the time, and people say that sometimes it even moves, so changes how it appears. So you might be experiencing something like, diarrhea, or something going on with your stomach that's really not, like, it's really stressful, it's not okay, and you can't eat, and that will then get better and you'll start to experience something else, which might be more, neurological, like pins and needles or something like that. Sometimes it stays the same, sometimes it's the same symptom that continues and comes and goes. So, it'll be something you know, your stomach will be a problem. It'll get better, it'll get worse, it'll get better, it'll get worse. Yeah, it's important also that we notice that it affects people differently. So just because I am, the way that COVID seems to appear in people is every person's different. We really know a lot about the respiratory side of things, so the breathlessness side of things, because a lot of those people end up in hospital because it's a little bit more severe in terms of needing medical support. So you need oxygen in order to breathe. Whereas some of the other signs and symptoms we hear less about. So sometimes there's a lot of people who suffer from heart problems. There's a lot of people who suffer from gut problems. There's a lot of people who suffer from things like sort of like feeling different. So like they are heat sensitive. So anything that they will constantly feel like they're almost, some people have described it as being sunburnt. And equally, there's some people who don't really have any of those physical signs, but they suffer this huge burden of fatigue, and they feel like a log is just a heavy elephant sitting on them all the time, and they can't do anything. It's hard to open their eyes. They've just got brain fog. So it changes and is different in every person. It's also important to note that once a person has had the infection and after 2 weeks is not getting any better, that after 2 weeks, they're no longer infectious. So especially in today's times when there's a lot of, you know, you need to self-isolate if you're sick, it's important that people who've come through the acute stage and they're 2-3 weeks better, that they're after 10 days they're no longer infectious to the community. So it's important that they start to try and get back to a little bit of normality, start seeing people, to remove themselves from isolation, because it can be quite mentally or emotionally frustrating, and they struggle with it. So the more contact that they can have with their family, with their friends, just going out to the shops, doing normal activities is good for their mental health. So it prevents them from, it's important that they allow themselves to do that, and they're not fearful that they might be spreading COVID. So it's who is suffering. So 75% of people have not had a positive test. It's more women than men. And it's more people who are not admitted to hospital than those who are admitted to hospital. So we're finding that there's a lot of people that we don't know about. So it's people in the community who were struggling with their GP at home, who never were sick enough to end up in hospital. They were sick, and I think this is something that they're also experiencing or expressing, is that they had this illness of COVID, but they never got hospitalized. And some people who are in their family who also got COVID aren't experiencing this long COVID. So they don't understand, but you weren't that sick. But it is important that they were that sick. It's important to verify that they are still struggling because of the way that their body's reacting to COVID. Most people that seems to have it is in the 30 to 59-year-old age group, and it's often the white ethnicities, and that might just be because of the current stats that are coming out. Maybe the Black ethnic minority groups are just not coming forwards and presenting at their GPs for whatever reason. And what they've started to find is that when you start to have COVID, so that acute stage when you're sick in the beginning, the people who have more symptoms than the average, so the average is 13 symptoms, if they have, so the average of people who end up with long COVID is having about 13 symptoms in that first stage. So it's not just your standard fever, temperature, and like, you know, chest respiratory problems, breathing problems. That's not to say that those people might not get long COVID. It's all about how your body recovers. The common fatigues, the common symptoms that people end up having in those early stages, if they have these symptoms, they will they have a greater likelihood of developing post-COVID. So if they have fatigue and a headache, they have a 90% chance of developing post-COVID. So it's very important, if they have those signs and symptoms, to be careful about returning and resuming normal activities. If they have shortness of breath and asomnia, so that's loss of smell, then they become 75% more likely. If they have a cough, sore throat, fever, or myalgia, which is general body pain, they're 66% more likely to end up with post-COVID. So if they, in the beginning stage, have these signs and symptoms, it's important that we get them the help that they need. At the same stage, there are a large portion of people who don't end up with ongoing symptoms, so, and still have these signs and symptoms in the beginning. It's important that people know that 90% of people will get better within 4 weeks, and the majority of people will get better initially. So if people are as we're saying, there's still people in the community that might be getting COVID, the fear of getting long COVID shouldn't be something that they're a burden that they need to bear at this whilst they're trying to just recover from COVID itself. Most people will get better. So 4.5% of people might continue to experience symptoms after 8 weeks, but after 12 weeks, so that's 3 months, only 2.3% of people are still experiencing symptoms. So it's a very small amount of people. But what we do know that is, without support and management in the beginning, these symptoms tend to get worse. And it's, one of the reasons is that if they're not getting the support that they need, the symptoms do start to get worse, because if you think about it, if you're not treating it, if you're not managing it, you're almost actively resisting or not allowing it the chance to get better. So we need to sort of understand and reach out to help at the beginning stages as much as possible. So what are the symptoms? So there's something called brain fog or cognitive dysfunction in the highest root terms, and about 85% of people with long COVID experiences brain fog, and they describe it as something they're unable to concentrate, they have difficulty thinking, loss of memory, difficulty problem solving. It impacts the ability to go to work, which is really important to realize, because I think one of the things that people are really experiencing and struggling with is employment and going back to work. Their mood and emotions might be changed, so 88% of people experience that: anxious, irritable, depressed, mood swings, and it's important that not all of them had a previous problem with anxiety or depression. 78% of people find it difficult to sleep, so either they can't get to sleep or they find it difficult to get back to sleep once they wake up in the night. And 91% of people, the most common symptom is that they have this fatigue, and fatigue is something a little bit more than tiredness. So some of us might have, you might wake up, it's a Monday morning, you're like, oh dear, or it's Friday, you get really tired, and you go to sleep and you wake up and you start to recuperate. Fatigue is this ongoing feeling of just not being able to do anything, and nothing really makes it better. So going to sleep doesn't help. You can't concentrate. Your body feels heavy. Sometimes your bodies might be actually sore. It's a different type of feeling, and one of the things that associated to it is something called post-exertional malaise, which is basically meaning that after you've done something, your body becomes extremely tired, and that doesn't necessarily only have to be a cognitive thing. I mean, an physical thing. It could also be a cognitive or mental thing. So people might experience going out for a walk and then becoming like, a couple of hours later, the next day, a couple of days later, being extremely tired from that walk, and their body just basically shuts down and won't let them do anything. Equally, they might just do something like going to work, where they have to sit and they have to concentrate for a large portion of time, and that just knocks them out, and they have that same effect a couple of hours or a couple of days later, where they just can't do anything because their body's trying to use all the energy that they have to recuperate, and now they've put this extra thing to try and use more energy that the body doesn't have. So cardiovascular symptoms, so basically heart problems. So they have heart palpitations, tachycardia, and they have pain or burning in their chest. Gastro conditions, so diarrhea, vomiting, sometimes a loss of appetite. So the obvious ones that we all know about, the pulmonary and respiratory, so they have shortness of breath, which seems the most common thing that goes for long term, is this inability to breathe, and this, what our physio calls air hunger, is basically you're trying to get air in as much as possible. They have a dry cough, other breathing difficulties. Most of those will get better within the short term, and after 2 months they start to improve, which is mostly about the lungs just healing themselves. Then you have musculoskeletal problems, so muscle aches or joint pain, and that affects their ability to exercise. So people really find it difficult to get up and do something. So when you combine a whole bunch of these things together, so you've got your muscle aches, you've got your fatigue, you've got the brain fog, and you're anxious or you're depressed, combining all those things together make it really difficult for some people to get up and get going, because everything sort of seems against them at that time. So it's important to note that with all these symptoms, if there's not enough intervention and support, there's a chance that they get worse and continue to experience symptoms. But it's also important to know that because there's such a variety, we can't say to someone, you do have long COVID and you don't have long COVID. I think it's about, if the person's still experiencing symptoms, trying to help them with managing those symptoms as best that we can. At the moment, we don't have any medical treatment, and it's unlikely that things like this will be treated medically. It's rather treated with behavior changes. And most patients will slowly improve over time, but there is a small portion that will get worse. And what we have to think about is the triggers that are creating, so something in their life that they've changed their pattern of activity, which triggers them to get worse. So some things might just be using too much energy, so going for a longer walk, or doing an exercise, or going to visit a friend, or going to work might trigger something to get worse, or just any type of stress that's in their life. So if they were doing okay and they have something completely unforeseen, so, you know, whether it be something with your parents, your children, something you can't control that causes stress might impact it. So how can we help people? It's important that, like I say, that we help them as early as possible. So many of these patients, people that are suffering from long COVID, feel like no one's listening to them, and no one's really understanding that it's real. And it's important that we validate that it is real, and we don't tell people, oh, you're making it up, or we brush people off and say, I'll just go home and you'll feel better tomorrow. And especially with regards to getting back to work, that employers understand that this is real and that this person is not making it up. And if we make them go back to work too soon, they will continue to struggle, and they might get worse because their body's just unable to cope with them. In the beginning stages, and most important is rest and real rest. So we all think of rest as sitting on the couch and watching TV. It's not rest, that's watching TV. Rest in terms for people that are struggling with fatigue, rest is sitting down, closing your eyes, maybe having a cup of tea or staring at the garden, but there's nothing visual that you're looking at, any screen time is really exhausting. So not reading, your eyes aren't busy, your ears aren't trying to make sense of noise from the outside, your hands aren't busy, you are still, and that's what real rest is. And as the body is still, the mind is also still. So try not to think about all the different things that have to happen today or that you haven't done. It's literally putting those aside. For this 10 minutes, I'm not going to think about anything, and just calming down. Pacing is something that's really important, and we were talking about that earlier. And pacing is when you start what we almost call balancing your activity. So in order to to do something, you have to balance it with some rest. So we think of it in terms, I like to think of it in terms of like a battery. So if you have a full battery, you have lots of energy to do lots of things, but as you start to do those things, your battery starts to fall and you can get into the red. You can get into the orange and then you can get into the red. But if you're in the red, it takes a really long time to get back up to being full. And if, however, you don't dip into the red and you just dip into 80% and then you stop and you recharge to 100%, it'll take much quicker to get to 100% where you've got all the energy you need to do the next activity and you haven't exhausted yourself. You don't want people to drop below that, into that even that orange. When they're in that orange, they need to stop. The moment they get into red, they're going to tire themselves out for days to come. So it's about trying to help them to set realistic goals and thinking, not doing everything, but what can I do within this day? Helping people to manage their anxiety and their stress. It's really important that you help them understand they're not going to die. If they're at home, especially if they're not in hospital, if they're at home, the health professionals think that they are good enough to stay at home, which means that they're not worried that this person needs more medical care. So they will be able to survive at home and that they will get better. So 98% of people will get better. It's just about checking up on them and making sure that they're not getting any worse. So one of because these symptoms get better and get worse, get better and get worse, it's nice to have someone checking in and being like, how are you doing today? How are you getting on? Just so that they might feel a bit more supported. Most tests will come back positive, normal. So if they go for a brain scan or a heart x-ray, they'll come back normal. But if the GP, if they notice that things are getting worse, then just let the GP know. And there's something called worry buckets where you sort of try, and when they trying to reduce their worries during the day and getting them to write them down and giving them time or allocating time that they can then go and worry about those things. So almost like if you think about, I'm going to set this time aside to go and do a run, they're going to set this time aside to go and worry, because that energy that worrying creates is really exhausting, but it's not very helpful to them. So if they can split it down, and then during that time when they've set aside time to worry, they can think about, okay, is this realistic? Is this going to happen? If it is going to happen, what can I do to stop it from happening? Or what can I do when it does happen to help myself? And they can think about it in a time in their day. And then most important, a healthy lifestyle. So many of these people might struggle to eat because they're breathless or they're tired, so they can't, they just don't have the energy to cook food. And also the other problem with not having the energy to cook food means that you'll end up doing things like getting takeaways or just grabbing something easy, which is filled with sugar and things you should probably not be eating, not lots of vegetables. So encouraging good eating habits and attempting not to skip any meals. It's really important they get all the right nutrients so that they can have and recharge their batteries. Vitamin D is also really helpful. I've done a couple of studies that vitamin D can be really helpful, especially in those people who are hospitalized. And then breathing exercises. So I've given a slide and there's some breathing exercises on there. And those both help with their shortness of breath and to help relax. It's about some of the main things that you can help people is listening to their bodies. So trying not to push themselves. If their body feels tired, let themselves rest. And sometimes the most important thing about pacing is that you don't necessarily wait for the symptom to tell you you're tired. You stop before you get to being tired, and you use your 80%. Okay, if I have 100% energy, what is 80% in my day? And I've used 80% or I've used 20%, so I need to rest, and not listening to my body saying that, I've got loads of energy, because lots of people have lots of energy and then go and do lots of things because they've got all the energy, but that exhausts them. So they need to balance the rest and the activity. So just identifying their triggers. So if they're doing a lot of activity and they're starting to fall into patterns where they get symptoms again, helping them write down what they do in their day and noticing what's different when they have energy, what do they do, to when they're tired, and if they have lots of energy with what they do, does that cause a trigger or a knock-on effect the next day? So sometimes people have said to me that they've tried to stop dominating the virus and start trying to accommodate it, and someone else said stop trying to get fit and start trying to get well, and then learning their patterns so that they can reduce what they're doing if the need be. So we always say start small, and then just, if that works, add a little bit more on, add a little bit more on. And if that starts to exhaust you, stop and go back a step until you can do that without getting tired. It's all about learning how to manage their tiredness better, because that ends up resulting in a loss of the symptoms coming back. That's just more things. So with regards to navigating help, people are really tired and they can't necessarily think straight, especially at the beginning stages. So sometimes they might need your help to get to the GP or to think through things or get the help that they need. We have developed, or we are in the process of developing, a post-COVID syndrome service, and it should be open to GPs at the end of Feb, possibly only in the beginning of March. But if people are still struggling after 3 months, it's important that they then get to their GPs so that they can help. And so, yeah, so, or we can have before we go through this, we can, I'm just going to hand over to Jules, who can give us a little bit of his experience of what he feels like as someone who's living with long COVID at the moment.
Okay. Hello, I don't know. Can you hear me? I can't hear you now, you've gone deaf. There you go. Okay, all I can do is I can see you on it. Hi, if you can hear me and see me, yeah, I'm Jules. I was in hospital back in March last year, end of March, April with COVID. I had it pretty badly, 4 weeks fighting it. Spent a week in high dependency unit. Thought when I came out that was going to be it, to be honest. I was going to get on with my life. Unfortunately, it didn't quite work like that. I was just absolutely exhausted, fatigued. I couldn't get out of bed for the first couple of weeks. I was bedbound basically. This got slightly better. My breathing still isn't good at all. I get very breathless very quickly. And the brain fog, you can't describe it. It's awful. You're talking to somebody and you just don't know what you're talking about. You can't remember anything. It's just so confusing. It's probably the worst condition of it, I think. The anxiety and the depression, yes, I had that very badly. I'd be sat watching television, I'd just start crying for no reason. I still can't watch the BBC News programmes about COVID. I find them too distressing. It brings it all back. Everything I witnessed in hospital. I've got this terrible tinnitus, which is ringing in the ears. It's just constant noise in my ears. It's driving me absolutely crazy, to be quite honest with you. I usually have to sit with headphones with music playing to try and drown it out. What else have I got? The aches and pains all over the body, obviously. But I mean, to me, apart from the breathing, it's the brain fog. It's just not knowing what you're doing from 1 minute to another. I could be talking to you now, and then who am I talking to? What am I talking about? It's crazy. I can't really remember people's. I'm having a conversation. I can't remember people's names. I've just been speaking to them. It's not good, to be honest. I've had it for just under 11 months now. I came out of hospital the first week in April, so it's quite a long time to have to put up with this. But talking to Claire, it's hopefully things are going forward now. We seem to be forming groups now, self-help groups, talking about our conditions. Nobody's conditions are the same. That's the other thing. Everybody's got slightly different symptoms. I know 2 people with tinnitus plus me, and nobody else has got that. Some people say they've got achy joints, their stomach upsets. I mean, I get, I do get vomit, I do get diarrhea, but again, you have good days, you have bad days, you have good weeks. You think, great, I'm getting better, I'm gonna beat this, and then all of a sudden, bang, it hits you again, and you're back to square one all over again. I don't know if any of you guys have got any questions for me, but if that helps.
Yeah, has anyone got any thoughts or questions based on the information or anything that Jules has shared?
Save me waffling on for hours.
Said, I think you've got your hand up. Oh, you're on mute.
There we go. You're on mute. Thank you. Hope you get better, soon anyway. Because I mean, when I first saw you, I thought, oh, he's taking it quite easy. But now that you've talked and the way you are looking as well, I think people do need to understand that it is real. Because in my community, they still got this theory, by the way. It's not real. It won't happen to me. He up there will look after me. Hold on a minute. You got to lock your door before you say leave it to him up there. But this is where we are. Even with faith, they think they leave all the faith to him up there. But faith doesn't say that. You have to put it first and then leave it. I mean, looking at you now, I wouldn't want anybody to be in that position at all,
Oh, me neither, to be honest. I mean, you say about people they don't believe it's real. This disease, it attacks anybody. This virus, it attacks anybody. While I was in hospital, there was old people, there was young people. The guy, when I was in high dependency units, I mean, I'd go to sleep. There'd be 4 of us in the ward. I'd wake up in the morning. I'd be the only person in there. The others were either taken down to intensive care or they didn't make it. It's bloody horrible. But I mean, fit people. I met a guy in there, a guy called Dave Lewins. He's a fighter pilot, and he spent a week in the ICU on a ventilator. And he's fit as a fiddle, and it just wiped him out completely. I'm still friends. I mean, I still talk to the guy at least twice a week, but it affects absolutely anybody can get this disease. It's horrible. Did I run out of COVID? Yes, I did. I've got a lung condition. I went to the doctors. I thought I've had pneumonia 3 times, and this felt just like pneumonia. My chest was tight. I was coughing. I couldn't breathe. So I went to the doctor, and he said, "Oh yeah, you got a chest infection. Here, take some antibiotics. Go away. And you'll be all right in a week." A week later, I finished the antibiotics, and I couldn't breathe. I literally could not breathe. So we threw in the doctor heard me breathing, and she said, "Go straight to hospital." And I was taken. I went to casualty, taken in, straight into isolation. Which everybody who goes into hospital now, if they think it's got COVID, they put them in isolation. You get the test. 24 hours later, you get the test results back. If you've got COVID, you're moved into the COVID ward. If you haven't got COVID, you stay on another ward, obviously. But I had COVID, so I was moved straight into the COVID ward. I had a private room, luckily, for the first week, which was rather nice. But then, like I said, all my stats just suddenly dropped. That's the other thing. You can be doing okay with it. I thought I was getting better. First week, my stats were okay. Everything was good. And then suddenly, bang, the next thing you know, I'm in high dependency unit. Everything just dropped. I lost my blood oxygen went down to 56, 57. And it's just so sudden. Like I said, the first day I was in high dependency, there was a lady came in opposite me, purple hair, lovely old lady. She was on her phone, talking to her kids on Zoom or whatever, Messenger. She was there talking to them. 5 minutes later, she just died. It's horrid. I mean, I should tell you the other story. This is what depressed me. I still get flashbacks to this one. When I came out of high dependency, I was put back on a ward with 3 other guys. And the guy in the bed next to me was a 76-year-old chap. 5 o'clock the one day, the nurse came up to me and said, "You're not going to make it. You're going to die tonight, we think. Do you want to phone your wife and say goodbye to her?" And I had to listen while they phoned his wife on speakerphone. And this poor guy had to say he'd been married for 50 years plus, and he had to say goodbye to his wife on the phone. Absolutely heartbreaking. I mean, I still get flashbacks to it now. He didn't die that night. He died 2 days later, but it was absolutely horrible.
I think that's an important thing to realize, is that the best thing that we can probably do right now is really reach out to anyone who might be struggling with either COVID or long COVID, because the listening to the stories that Jules kind of is saying is there's ongoing things that you might not know, but the experiences of being in hospital, experiences of living through having this illness are really, really, really tough. And I think being a listening ear is so important right now. I'm just going to answer a couple of questions that have come through the chat. So the GP services, so some people have had good experiences, some people have had bad experiences with their GPs. So I would really recommend that if someone's sounding like someone who's struggling still, that you get them in touch with their GPs, and the GPs should be able to just keep pushing their GPs, and they will be able to refer into our service. So the post-COVID assessment service, towards the end of February, probably March time, we're trying to push that they open it as soon as possible. But just keep telling them to get help from their GPs. Their GPs do have resources that they can help with, and they can refer them to other services that are currently, so like Jules is struggling with his breathlessness, they can refer them to the respiratory services in the meantime until there's some help that comes along. And then the question about the group that he belongs to. So we've set up a patient information, a patient support group. Just brought people together that are struggling. If anybody has anybody that they know of that has long COVID and would like to be involved, Jules set up a Facebook group on Jules, what is it called? Gloucestershire.
You've got me now. I'll have to go and check.
Yeah. Is it a
I
very
set
long
up
name?
two, actually. I set one up when I first came out of hospital. I set up a page for people who had actually been through the same experience as me to write their stories, positive stories about how we've survived it. That one's just called I Beat Coronavirus. But that's on Facebook. I'm just going to have a look. I'll come back in a second. I'm just going to have a look, see what the other one's called.
If you get the link, Jules, and if you put it in the
I'll
chat.
do that now for you now. Yeah.
And so people can join the group, and we'll put all the information there so that people can get in touch and get involved that way. Someone had their hand up.
I think it was me earlier on, Dennis.
Yes.
Yeah, I did it early on. It's only a few things that's coming through my mind, but who's it? Ray said one thing while I was thinking about it, which I'll get to now. He mentioned faith. Some people are reluctant to believe that this thing exists, and some people think, because they're of a certain faith or Christian or whatever, they think, oh, God will work miracles. And the trouble is, what I have had to say this to quite a few people recently, maybe God is taking care of, because if they remember what some of the scriptures said in various religions, he's given man, imparted into man, is a certain gift, certain skill. If you look throughout the Bible, for example, it shows that Jesus Christ imparted the power for his disciples to heal, and so on. They've all gone, but it's like everything, it spreads on down the line. So the way to look at it is imparted to scientists, to the doctors, etc., etc. Wouldn't deal with the politicians; they're not a different set. And to have certain skill to heal or to help you to go, but you also got to use a lot of common sense. So we can't just rely on. Sorry if I upset anyone. on just blind faith. We must direct the faith in the proper, channel it in the proper direction and see. Because one of my beliefs is that it sounds a bit strange, because I often say to myself, if you truly believe that, you know, God can reach down into hell and pull you out of it. Because if you think about it, one of Christ's first miracle was turning water into wine. So therefore, if you think that a COVID vaccine, which I took the other day anyway, on Monday, was it Monday? Well, took the other day. It basically said, if that thing is, you think it's going to be bad, and if you've got a true faith, then, you know, it will become good. So that's another way of looking at things. However, I saw slightly digress, just things that came to my mind when Ray said it. To Jules, sorry about what you're going through, but particularly that you're spelling hospital and the recurrence of seeing and hearing what happened to other people around you. I think that, you know, it's very traumatic, and I think you're, in my view, you're still suffering from that, because I have had a similar problem, not with COVID or anything, whereby I literally had to get my mind outside the hospital building, you know, thinking about things like walking through the forest and tonight, just because I could not cope with the fact of being, because there's so many bad memories of what I'd experienced in the hospital. That's the only way I could survive it. And what you've been describing, things that came into my mind was the word overkill, and whether or not if they should check you now, whether the antibodies, which probably you would have in your body now, are at a very extremely high level. Why I'm saying that, I'm just thinking, most of the symptoms that seem to, they all include one thing, this breathlessness, as if you're exerting yourself beyond that point where you're gonna get breathless. I mean, if you think about it, your body have been in a big fight with something, and it's just trying to survive. So, you know, being in that big fight, you're gonna be breathless. So maybe that's, you know, I'm not a doctor, but maybe that's another way to direction for the doctors, the powers that be, to start looking at. And yes, I think the doctors themselves are stressed up. We've got to remember that. But I think it, in their case, like the group that you've found in Jules, I think they ought to just do it. Just treat everybody as if they will have the syndrome, and put the parameters down, so that they, rather than just say, okay, we'll treat you, put them as a progressing straight through into it. I better shut up because someone else wants to speak.
I think that's very helpful. I think it's almost like, yeah, if anybody is sick with COVID, helping them in the beginning stages of their recovery to really think, to do some of these some of these techniques about practicing their breathing, strengthening their breathing muscles, practicing pacing, don't fatigue themselves, don't tire themselves out. It may help people who would have gotten sick, but not to get as sick as or stay as sick as they were long term.
Claire, Blanche asked a question about counselling services.
So we don't have any counselling services besides IAPT, so they can go self-refer to IAPT, but we haven't got any counselling services set up as yet. We are hoping that with what we can provide and getting the right funding, would be able to provide that within the service that we're trying to offer. But at the moment, it would just be, and if people are needing counselling, they can self-refer to IAPT, so they can just do a normal referral.
What does IAPT stand for?
Oh.
You don't know?
Good question, but it's the mental health, anxiety, mental health. It's I can put the website in the.
Okay. That says psychological therapist.
Thank
Gwen.
you.
But you might want to just explain a little bit about it rather than the acronym.
Yeah. So IAPT is, it's basically that. Yeah, exactly. That is psych therapy. So it's mental health support. So it helps. It's a service that provides support for people who might be struggling with anxiety or depression or post-traumatic stress disorder, or anything that's sort of impacting their ability, their mood and their emotions and their ability to function in a day-to-day life. So I will put the link in the chat. You can do a self-referral, or your GP can refer you to them, and they accept. So even if you just feel out, I mean, this lockdown, as Di said earlier, it's been a much harder lockdown, and people are really, really suffering. It's dark, it's cold, and it seems never ending. So even in those terms, like people don't necessarily have to have you've got this condition to refer to IAPT. They can just do a self-referral and say, I'm feeling a little bit out of sorts. Don't feel like myself. I'm feeling a little bit anxious, or I'm feeling a little bit more depressed, and they can refer on to it. Thanks, Rach, for putting the link in the.
I think Bren's got a question.
Okay, so firstly, I'd just like to say thank you for what everyone's doing in the public-private shops, buses, whatever, really, in terms of that delivering a frontline service, really, because you've just mentioned about people being tired, and that's people, in terms of getting treatment, etc. And we shouldn't ever overlook, if we are talking about the NHS, public health, county council, social care, and all those other bits, that people will be tired there as well, really. So the question is how have GPs welcomed this, really? Because I think it's great that we look at that prevention as you've described there, really. But in terms of, certainly what I see is that with the vaccination, etc., and all those other things going on, or whatever, really, is, in terms of if they have the capacity, and with all the other things going on, really, will they still have the capacity? That's my first question. I suppose my second question is, what are we doing, putting monitoring in place to see if this is a successful service, or it makes things worse or whatever? We hope it's going to make things better, don't we, really? But what sort of measurements are we doing? What are we doing to go back to people to say, again, how did you feel about that service? What are we doing to monitor it?
Yeah, so with regards to the GP's capacity, yes, it seems, we've spoken about this several times, we've got GPs working with us in developing the services. It's really difficult because everything comes back to primary care, and GPs are struggling because they don't have the capacity to help people. I think that's where us being a helpful friend to people who might be struggling is that the GPs they've been given training, and there is availability of knowledge for them if they are unsure about what they can do to support people. But I think that's where us being a helpful friend to people who might be struggling because they might be too tired to tell their story again, or the GP's not listening, and it's our sort of almost an advocate role to kind of help them out and just keep pushing that GP to say, this is not right, this is not right, this is not right. They need some more support, and the GPs would be able to reach out and get that support for that person. They've got resources that they can then hand out to a person who arrives in their GP practice or on the phone. It's just, it is a struggle at the moment sometimes to get that appointment depending on where you are. And I think that it's just about, I do think that it's helpful to have someone who's persistent with the patient, because the patient, whoever's struggling, might be very, very tired, and tired of being told no. And then with regards to measurements, yes, so we've got many outcome measures that we're trying to measure. So in terms of success of the intervention, so how people are recovering, what types of people, how long it takes people to recover, what signs and symptoms are they experiencing, and what does that look like for them as they recover. And then that's for me the most important thing is measuring what is our success rate within the people that we're treating, and is that so we can look at patients who've never had any intervention, and once they've had intervention, what does that picture change? Does their story change? Do they end up getting better, or is it a continued experience that's much the same as it was before? I think that there's loads of research going on into what treatments are effective. We've got face-to-face treatments, and there's an app that we're uploading people onto, and it will be determining because the reason we're using an app means we can get more people the help that they need. It's just not as individualized or not as personalized, not one-to-one. It's not face-to-face, which might not be effective for all people. So what we're trying to do is create the app and monitor it closely so that we can monitor those people that need a little bit more of an intervention or a little push or a face-to-face or a conversation so that they can get that next level up. But we're also finding that the support group is quite helpful for people experiencing and sharing stories.
Thanks, Di. Thanks, Claire, and thanks, Jules, for selling and welcome to your dog as well. See in the background.
Sorry about that. Yes.
Lovely to see. Blanche, have you got a question?
Yes, just a point really about Jules. Really, I know that in the hospitals it is really manic, really, but listening to him, what nurse would be saying to another person who they think is going to die, and all of those information. I think there and then the hospital should have made some arrangement, even if the person don't understand about counseling or, just to reassure them, because, I know that it's panic in that way, but something should have been had, not allow them to just go home, knowing that they hear all of this, and that could have been them. And it put them into a position where, if anything, again, they would want to go to hospital, they are ill, and they may not want to go because, they don't know the bad news that they are going to get. So I think those situations need to be addressed and maybe taken on or passed on to the NHS to say, something needs to be done to reassure them, because I know in normal time that does not happen. You don't happen to go and just say to the person you're going to die. But in this situation, the person shouldn't be let home without saying something to them about what they have heard.
Yeah, I agree.
Hospitals would be absolutely lovely places if they weren't full of sick people, to be honest. But yeah, no, it's I do agree. It's but to be quite honest with you, the nurses I've never seen so many medical people. It's almost like a panic it was. I mean, this is very, very early on. I mean, I went in end of March, and there were so many medical people working there, and they just did not stop. It was, I mean, you got to understand, because we're in isolation, so to speak. Every time the bell rang, or there's 4 people per ward, and when I was in HDU, like I said, every 15 minutes I was having my stats done. 24 hours a day, they're doing your stats every 15 minutes. Now, a nurse would have to come in, gown up, gloves, masks, everything, do me, go wash, take everything off again, go back out, and then 10 minutes later, somebody would ring a bell and they got to do it all over again. It was just, there just wasn't time for anything else, I don't think.
Thank you. Has anybody I've got a question actually. You mentioned about employers, Claire, in terms of them properly understanding about the recovery. Have you done much work, or is there planned work to work with employers more in terms of increase, their understanding?
Yep, we're going to try and get some. So we're trying to develop a webinar session for community and invite people along to come and sort of learn. But one of those groups is called Healthy Lifestyles, and they have a work related group or focus that works alongside workplaces and employers. So we're going to try and get in that way, but recognizing that they don't have everybody on that. Not every employer is involved in that. So we want to try and do some general communication and marketing. Well, I shouldn't say marketing, but general sort of awareness campaigns so that it's in people's line of vision or spaces without having to come to anything special for them.
It needs to be put out in the media more, I think, to be honest.
Yeah.
Local papers, television, radio. There's just not enough information out there about it. People don't understand what the condition's about, and how debilitating it really is. It's some people just say, "Oh, you're making it up." I haven't said that. They said the same about COVID. Apparently, I had the flu. Apparently, somebody told me, but there you go. It's but no, I think the media need to do more personally.
I agree. I mean, we've recorded all these meetings, and so today's will have been recorded, and we've got a page on the County Council website where all the community meetings on you can be shared, so that that resource you could use it if you wanted to, Claire, to for other meetings, and we could share it. And I guess the purpose of us all coming together this evening is because we want to help and we want to raise awareness. So if there's anything that we can do, we you just need to let us know, in terms of disseminating information or raising awareness.
Yeah, I think that it would be really helpful if you know of anyone who's struggling with long COVID, to help them. That the slides will be shared and my email address is on there. So feel free to get in touch with me and we can try and give them the support that they need, just through resources. At the back of the pack of slides is a couple of simple handouts and websites that might be helpful for people who might be struggling with some of the big issues like fatigue and breathlessness. But please do share them around and try and just, any way that you can help your own community to understand or find the knowledge, the resources. I think that's really, really helpful to us. There's so many different. A lot of people have stopped watching the news or reading the news at the moment because it's not exactly the most inspiring of events. So I think if we can be the old-fashioned news and just talk it to our neighbours and just help raise the awareness ourselves, it'd be really, really helpful.
Thanks, Claire. Thank you. I don't know if there's any other questions. Because we're past 6:30. I can see that Jules is getting a bit tired. We've got a couple. Okay. Oh, Cleo, did you have a question? Oh, you're on mute still.
It's not totally a question. It's just what's the word? What I'm listening to. I can't think of the word. That being from a nursing midwifery background, you pick up little bits. Now I'm retired, and you hear things, but nobody ever knows the full picture or gets to hear things, and you just hear little snippets on the news. But the emphasis is on people dying, and not on people who, like Jules, is still ongoing and suffering. So I don't know how that. I'm not saying we mustn't talk about people dying. Don't get me wrong. However, there are people now suffering with the effects that can't see a way out.
Yeah.
And I don't know how that's going to happen or how it can happen. So maybe like we're having this Zoom meeting. I mean, I know not everybody's got Zoom, but something so that people who have gone through it or going through it or family members can have some way of being in a shared community.
Yep.
I don't quite know if I'm explaining it properly, but you know what I mean? It's the
think you-
aftercare and
Yes.
the good old-fashioned next door neighbour care, and you know, those things that have been lacking for years. It's now that they're so important, and I don't know how we're going to foster that kind of you know,
Care.
bring it back again. Yeah.
Yeah, I think I completely agree with you. And reflecting from what our patients have told us is, well, from patients and other people, is it's too depressing to watch the news. And then people who, like Jules just said, watching the news about COVID and people dying, it just all brings back too many bad memories. And there's no hope of, will I ever get better? So one of the things about the people were saying about long COVID in the long COVID group is you don't hear stories of people who've gotten better. So you just think that this is going to be your life because no one's said that they've gotten better. So I agree with you, and that's almost like why I think using these platforms where you're the little, almost the disseminators of the knowledge into the neighborhood, and you go knock on people's doors and just raise awareness and let people know, and slowly but surely we get that hopeful ripple effect. And I'm trying to do as many of these as possible to get to as many of the local communities as possible, but I don't know how we bring all those stories together. Facebook is one way, but I don't think it's accessible to everyone, such, you know, the same way like a Zoom meeting isn't. And it's really that connection that people need, that face-to-face, that person on the other side that says, I'm here for you.
Yeah, because that's the problem now, that everything, you can't go anywhere. I mean, there are so many community centres, church buildings, you know, little where my children used to go for Girl Guides and Scouts and Cubs. You know, there's all those community centres and hubs, but now nobody can actually use them.
Yeah.
And so everyone is so isolated. So isolated. It almost makes you want to bring back, not the sort of, you remember on the Thursday evenings when people came out into the street and everybody was clapping, and then you'd wave to the neighbours, people that you didn't see all week, but you'd wave to them, and there was a feeling of togetherness.
Yeah.
So it's something like that we need. I don't know, like the old-fashioned maypole or whatever it is, but something that would bring back community spirit, I think.
I think it's interesting you said that about the hand clapping. Someone said that to me the other day, that they didn't necessarily see the benefit of it in clapping for the NHS, but they saw the benefit in it of just, it brought everybody out of their houses at least once a week, and you could see that your neighbours were okay. But I think that on that note is, you know, we at this time, maybe we can't do something as big as clapping for the NHS on a Thursday, but we certainly, and we might not be able to meet and gather in each other's houses, but we can certainly knock on people's doors and check that they're okay and just say hello, and make an effort of you know, maybe, you know, once a week making an effort to see someone in our neighborhood and make sure that that we're reaching out to someone. And maybe it's I don't know if anyone's watched the movie Pay It Forward, where if I do one thing, three good things, and that person then goes and does 3 good things, and that person does 3 good things. If I reach out to 3 people and say, okay, now you have to go and reach out to 3 people, we can start a small community gathering that might sort of inspire some hope in this time.
Yeah, perhaps you'll have to divide that then. The community, you know, do 3 things a week, or something that will get people to be out, because you have to go outdoors for a certain period of time, but to actually go outdoors and give, you know, beneficial to somebody else as well as yourself.
Thanks, Claire. I think Lyndon's got another question, Claire.
Yeah. If I could say something, I do agree with everything Cleo and also Claire said, but one of the problems is we can't rely, we're lucky, but we can't rely on the internet and everything, or the Zoom, because some people are just not conversant with it, and some people aren't able to access it. So probably something like leafleting or pamphlets and popping something through a door so that you can bring it to. But it's strange about this clapping that you said, Claire, because in a strange way, people could still come out. Don't just aim it at the NHS, because we're all in this fight. It's a fight for survival against something we can't even see. And let's make no mistake, it's got more devastating power than all the atomic bombs they've got in this world, because it could wipe us out if we don't treat it right. So why don't we go out, say 8 o'clock or whatever time, and just clap for mankind, you know, clap for ourselves against COVID? That would get you out of the house and you'd be doing it, you know. But I don't underestimate the efforts that the NHS is putting in, nor the police, for that example, because they got to be out there whether they like it or not. I know sometimes we're a bit skeptical of police, but on these occasions, you can understand they got to be out there. The firemen, they can't say, no, I'm not going out, because of, so they got to be out there. So, you know, if we just got and just clap for, you know, Britain, or clap for ourselves, you know, yeah, clap for mankind, because it's a pandemic after all. So it's all of us against this little monster, whatever it's called.
Yeah, I wasn't meaning it just for the NHS. I was using that as a
I appreciate, yeah.
as an example.
I was agreeing with you.
Yeah.
I was agreeing with you, but it just, while you were speaking.
Now we should move it on to, you know.
Yeah, to ourselves as well, you know, just to get us out, as you said, because that's a good thing. Get us out, see other neighbors, and it's a bit of togetherness for us all, you see, to lift our spirits. Oh, I know at 8 o'clock we'll go out and clap for each other.
Yeah.
Including the NHS, of course.
Everybody who's put it in the front line, shops, bus
Yes,
drivers.
we are. We certainly are in it, everybody.
Everyone's in it.
Thank you. So I can't see anybody more waiting to ask questions. So I was going to try and draw the meeting to a close. I think we've had a really good discussion and conversation. It's been so inspiring. It's interesting to hear your story, Jules. And we really do thank you for taking the time to talk to us, because it really, you know, explains, because it's difficult when you read slides to really understand what it's like for somebody that's gone through your experience. And we're very grateful for you to come in and talk to us. And we do wish you, you know, continued recovery.
For having me on.
Yeah, no, it was lovely to meet your dog.
Ah, bless.
Always good to have a pet. Always good to have a pet on Zoom, definitely.
Oh, yeah.
So, and thank you very much to Claire for speaking to us. I say all of the
well
information
done,
we'll put on the website, and also send out the presentation. And there's been lots of details about other resources that are available, websites and things. And again, we'll collate all that information in one place, so it's easy for you to distribute to other people that you're in contact with. So, so thank you very much for giving your time again this evening. We are going to try and meet again in the fortnight and talk about another issue. But if there's something that you'd like to have a conversation about and connect about, please, and you don't have to say now, but please let us know through the mailbox if there's something. I mean, if there's a speaker that we can try and arrange, we'll try and do our best. So, okay.
Thank you.
Thank you very much.
Thanks, Stu.
Thank you.
Thank you.
Bye-bye.
Thank you, Diana. Thanks. Thanks to everyone.
Bye.
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 And
Stay
keep well.
safe.
Okay.
Bye-bye.
Stay safe. Keep well.
Drive safely home.
I had my jab the other day.
Yay!
I'm too young.
Oh.
I can't have mine because I'm still 21 again.
All right, bye-bye now.
Right.
Bye-bye, Theo. Bye-bye, Side.
Bye-bye. Bye.
Nice to
Thank
see you
you,
again.
Diana.
Thank
Thank
you.
you very much.
Bye-bye, Carol.